We're going to be doing fat transfer to the face. The thing that I'm going to be doing first is I'm going to be harvesting the fat. So I can harvest fat from anywhere. I usually let the patient choose where they want the fat. And so today I'm going to be taking it from the lower abdomen, and then I'm going to re-implant it into the face. With fat transfer, you can take fat from anywhere and it can go anywhere. So you can re-implant it in the face, you can do breast, you can do the buttocks area, you can re-implant the fat wherever you need to go. I actually like fat better than filler because I feel like it lasts longer and it looks more natural. So for a lot of my patients who want fat transfer, I always recommend that they get filler first, especially if it's to the face area. Over time, as we age, a lot of times we'll get fat loss in our cheeks is the most common, or anywhere in our face. And so essentially doing a fat transfer to that area is like a liquid facelift with all the actual cutting behind the ear. And so that's become very popular, and I think that's actually the better way to go, having done both ways. So a lot of my patients, if they haven't had any of the fat transfer and they just want to know how it looks, I always recommend getting the filler first. The filler has different substances that fill the different areas, whether it's the lip, the cheeks, the nose, whatever it may be. But because fat is a little bit more permanent, although not completely permanent, it does last significantly longer than filler. I always recommend that if you're kind of on the borderline or just want to see what it looks like first, to do filler first, because that can last anywhere from 6 months to a year, depending on the type of filler, versus fat can last years. Now, mind you, if you don't like the areas that it goes in, we can always remove the fat that's put in with liposuction, the same way we harvested it. But we will be doing that today, and I will be posting before and after pictures. We're gonna harvest the fat. So this time it's gonna sit for a little bit longer than the last time. Because liposuction, you know, the lipomo is just a little cut. Liposuction, we've got to like harvest the fat. So the bigger cannula lets us fill more fluid a little bit faster. Like for this, it's just going to be the bottom belly. But and she's already, you can tell she's already numb. She's already blanching a little bit. Yeah, you want the blanch. That's how you know it's settled and it's ready to go. I usually will let this pretty much done. It's starting to blanch. We still have a couple more areas that we need to get. We'll let this sit, get a little bit more here and a little bit more here to kind of harvest the fat for the face. But we're getting there. Okay, so now we're harvesting, doing the liposuction. So you'll feel me, you'll feel like this is me pressing on you, and you'll feel that. But if you have any pain, just let me know. Use these small holes, and she'll drain out of these holes. And we're just going to do the bottom portion. So let me know if you feel anything. Done with harvesting from the abdomen. As you can see, there's like really tiny holes here, and it's a lot flatter than from what we started. So we'll take this fat that we kind of harvested, and we'll put that in her face next. Okay, a little pressure. And whatever. I'm going to try to tighten these cheeks up over here. The tightening you'll see after a couple months. The fill you'll see almost immediately. The tightening will take a little bit. Yeah, that looks good. And we started, you can see like this side, you can really see a difference between this side and this side. Just trying to recreate the cheek in this area. Okay. It's looking good. I want to fill on the bone. Make sure I'm laying it right on the bone. And this is like immediate. You can see the immediate effects of the fat. Oh, this is gonna need some cleaning.